Okay, I think maybe we can start our today's session. So, Sawadika, Mikalaba, Salaman Sien. Good afternoon, ladies and gentlemen. So, thanks to join today's online seminar. I'm Nina, the Director of Overseas Medical Mission Center of John Christian Hospital. I'm also the moderator of today's session. First of all, I would like to thank all of our participants from different countries and sectors. Special thanks to our three speakers. So actually, tomorrow is our Dragon Festival holiday in Taiwan. So after today's session, we are going to have a long weekend. So I wish everyone have good holiday. Yeah. I know maybe in the South Asia country, you don't have the festival and holiday, but in Taiwan, this is a quite important of the holiday for us. Anyway, so before we start session, I would like to invite Dr. Roy Lee, the Deputy Director of Taiwan's WHO Center of Zhonghua Institution of Economic Research. Dr. Lee is one of our best partners. Zhonghua Institution of Economic Research support many of our activities since 2018. So thanks so much to Dr. Lee and his team. So now let's welcome Dr. Lee to give the opening remarks. Dr. Lee, please.
Okay, thank you, Dr. Nina, and friends from ASEAN countries, Thailand, Malaysia, the Philippines, everybody. It's been my pleasure to be invited to offer you some information about the Health and Welfare New Southbound Policy Project Office. I'm actually one of the deputy coordinators of the New Southbound Policy on Healthcare and Welfare Coordination Office. So I'll be sharing with you some of the information of what we are doing at this office, and also what's the assistance that we might be able to offer you in the future. Let me start with a brief introduction about the New Southbound Policy. In 2016, the Taiwan government introduced the New Southbound Policy. The objective of the policy is beyond traditional trade investment area. The objectives are actually to enhance bilateral cooperations and also engagement with primarily ASEAN countries to create a long-term and sustainable partnership with our ASEAN partner countries and also other countries in this region. We would like to create a long-term benefits for everybody in this region, and of course, including Taiwan. So as the NSP, or the New Southbound Policy, is beyond traditional trade investment initiatives, it is actually a policy to create not only long-term growth, but also with a view of elevating the quality of life of all citizens in this region. So not surprisingly, healthcare has been chosen as one of the core policy areas at the beginning of the New Southbound Policy. There are two major programs under the Welfare and Healthcare New Southbound Policy Taiwan is promoting. The first is the One Country, One Center project. You can actually see behind me, there's a huge banner introducing the One Country, One Center project. 7 major medical centers in Taiwan, including the Changhua Christian Hospital, has been designated to lead the way and create a platform of health care and welfare cooperation with our 7 partner countries. Today's organizer, the Changhua Christian Hospital, is serving to lead the cooperation with Thailand, for example, and they have done an amazing job so far. And we are pleased and have the pleasure to be invited to join this webinar. The second program is the creation of my office, the Office of Healthcare and Welfare New Southbound Policy Coordination Office, or NSPO in short. My office is created back in 2018. The major function of this office is to support the implementation of the One Country, One Center project. And also we are trying to enhance the connectivity between the healthcare institutions and with the suppliers of medical and pharmaceutical producers in Taiwan as well as in our ASEAN partner countries. So in addition, my office, the NSPO, has also launched a dedicated website to serve as the information platform for all the relevant information, especially the supplier list for the promotion of the healthcare and welfare new standard policy. Let me just grab. I have prepared. This is the website that I'm talking about. There's a barcode here you can't really see, so I'm sending the web address here on the instant message here, so you can just click on the link here and it will connect you with the website. So everything I have just mentioned to you about the function and the objectives and the future work plan of the new start-up policy on healthcare and welfare are available on this English website. There's also a Chinese version of the website as well. And as you can see from this picture, we have recently created a new item on the anti-pandemic industry. It's a new initiative. We are still collecting qualified suppliers relevant to the anti-pandemic works for everybody. So thanks to Changhua Christian Hospital, for example, they have offered us a list of qualified suppliers. By qualified, we mean suppliers from Taiwan who have some received market approval or other certifications. That means they are ready to supply qualified products for our partner country to fight or at least to control the pandemic that is still ongoing. So please take advantage of this website for further information, and my office is always happy to help and provide assistance in any way we can. So as a conclusion, I would like to wish all the success of today's webinar, and I sincerely hope that we can start visiting each other in the very near future to advance our cooperation. That will be my opening remarks. Thank you very much.
Thank you, Dr. Lee. The next, I want to invite another Dr. Lee, and Dr. Lee Zhenyu, okay, to give the remarks. Dr. Lee is the Executive Committee of Asia and Pacific ICT Alliance Taipei Secretary Office, and he is also the consultant for Taipei Computer Association, as well as the Director of Taipei Smart City Project Management Office. So our speaker today are recommended by Taipei Computer Association. So welcome Dr. Lee to deliver his remarks. Dr. Lee, please.
Okay, thank you, Dr. Nina. Hello, I'm another Dr. Lee. Thank you for joining today. My name is Chen-Yu Lee, and you can call me Leo as well. And I'm the head of PICHA, Taiwan Secretary Office, and also the TCA. You know, we are very, very pleased to welcome all of you from Thailand, Vietnam, Indonesia, Myanmar, Malaysia, and other countries. I think that today's topic is the response to the COVID-19 in Taiwan and the smart healthcare technology for the epidemic preventions. So we are very proud to be able to help and co-host this webinar today with Dr. Nina from Changhua Christian Hospital. Before get started, I would like to brief introduce APICHA Award and also the Team Taiwan. APICHA Award is an ICT award which hosted by one of the 16 economic members from the Asia Pacific ICT Alliance every year. And Taiwan, we won 23 gold and 33 merits since joining APICHA in 2013. So especially the Team Taiwan, we played a very excellent records on smart healthcare domain of the APICHA award. So therefore, that's why we invite and recommend 3 of our winners to share their solution experience to all of you. They are Huijia Healthcare, LIPS, and the ThinkCloud, who provides include the smart care system based on non-invasive fiber optic technologies, and 3D vision and AI technology on healthcare detections, and also the zero contact signature technologies, which can help us to fight the COVID-19 in the future. So during the pandemic, I think we all agree we have been adjusting our lifestyle, and also, we trying to learn from each other during these pandemic situations. So I hope today's webinar can also help you to get more productive smart solution option to fight COVID-19. Once again, a very warm welcome to all of you. If you have any further questions, comment with Apita and also with those speakers, and also interested with our office, please don't feel free, don't hesitate to say hello to us. And I believe that Dr. Nima will help you, and also we are very willing to help you. So thank you very much. And also I want to thank to the Mr. Yang, Miss Yang, from CEO of the Huijia Healthcare, and also Miss Benson Lee, Director of Strategy Business Development from LIPS, and also the Antonio Tapia from International Sales Deputy Manager from ThinkCloud, who contribute to this webinar. And thank you, and hope everyone with good health. Thank you.
Thank you, Dr. Lee. Well, we are going to start our session today. So same as last week, today's session also focus on the smart medical products applied on epidemic prevention. So last Friday, we invite 3 companies, including iMedTech, Maxten, and SigTech, and Ion Force. So if you joined us last week, I think you still remember. And today, another 3 companies, including Huijia, Health Life Technology, LIPS Corporation, and ThinkCloud. So they are also very outstanding companies. So each speaker has 10 minutes to present how their products apply on COVID-19 prevention and any potential for the future application. Also, Q&A is after all speakers finish their talks. So all speakers, please control your time. So the first speaker is CEO Yang, Ms. Yang. She is the CEO of Huijia Health Life Technology. Her talk is response to COVID-19 with non-invasive fiber optic physiological monitoring technology and its smart healthcare. Ms. Yang, please.
Okay. Hello, everyone. I'm Shuchen Yang from Huijia Health Life. Today, I'm going to introduce our core technology, N4 and smart health system for COVID-19 application. COVID-19 death rate in health center are over 30% of the total in America and Europe because the elderly cannot expand themselves, and comorbidity makes it hard to manage symptoms. How Huijia can help? At Huijia, we have a non-invasive smart health system based on N4 technology that can check the breathing, the heart rate, the sleep, the pulse, and much more without wearing any devices. So I want to introduce Huijia and N4 first. We are a smart health solution provider for elderly and babies. We have a very strong professional R&D team from Hsinchu Biomedical Sci-Park. Huijia won many international awards, including Apita Awards, R&D 100 Awards, and ECI Awards. As you can see, all over the world, people are getting older faster. It's terrible. It is the same issue for all of us. For elderly and baby care, the most concern is their safety and health. Who can take care of them? How about the care quality? 2 big issues come along with an aging population, shortage and caregiver and insufficient care quality. The same issue come along with COVID-19. So all over the world, people use smart technology and wearable devices for healthcare. But do they have to wear devices? As you know, they don't really want to wear them or forget to wear them. Do you worry about electromagnetic wave for you on your babies or parents? At Huijia, we have a novelty technology, no wearable, no electromagnetic wave. We use the fiber optic sensor. Our core technology is NFOPT. So why no electromagnetic wave? Because we use fiber optics and its total reflection principle. The same is usually used in ICT industry to send data. Please think of this like a hose. Normally, the water comes in and goes out. The fiber optics is like the hose, but only 0.5 millimeter. And LED light is like the water. If you apply the pressure on the hose, the flow out is different. The fiber optics is very safe. It shows high temperature resistivity, no spark, no static electricity, high sensitivity and accuracy. We can detect the breathing, the heart rate, the pulse, the blood pressure, and sleep, and many other vital signs. We measure breathing and heart rate in all posters in hospital. Our signal match almost 100% PSG result. Our common competitor use piezoelectric technology. With piezoelectric technology, every small movement will create electromagnetic field. It's electricity. It is more difficult to identify movement and it has time to calibrate. However, our N4 no such field. We apply our technology to all these smart devices. We develop our smart care system to get the big data from them. N4 also can be applied for a lot of smart movement devices. Actually, we can even see smart body movements. You call, we say that. You turn, we say that. You nod your head, we say that. So we can program our technology for each person or their needs individually and with dignity. For example, the elderly can nod his head to ask for help without pushing buttons. Our technology also can combine IoT function. For example, when the elderly is stand up, night lights come on, the lights will switch off when he lies down. Now, we are developing world first high-end medical equipment based on N4. First, N4 can distinguish the type of a sleep apnea without wearing any devices on any bed. Just put 2 millimeter sensor under the pillow and bed cover. The results have been published in medical journal. The second world first, N4 is applied to smart continuous blood pressure detector without pumps and PPG. How smart care system can help in early stage, even without a fever, breathing change and persistent cold help us to identify the COVID-19 in early stage. The smart care system can know the breathing symptoms at the first moment and monitor continuously. Even without a fever, the system can help to find out the change comparing themselves. Smart care system can also help to protect the medical staff. Our smart care system provides remote and 24 hours monitoring, instant detection, continuous detection, reduce the content and reduce waste of the medical resource. We have 3 kinds of structures solution for different needs. Solution 1 is very simple to set up and monitor under 20 persons together in the center. Solution 2, it can monitor 200% at the same time with assistant and it can get the signal from multi-sensors. Solution 3 is very easy to use at home or isolate with apps. Our smart care system is easy use in care center and hospital. It can 24 hours auto run for health and safety and provide the abnormal alarms. Our system can also record the health data and provide daily, weekly, monthly report. It can remote continually the breathing change, sleep quality, and cold checking, no matter at home or in the center. There are over 30 care centers and hospitals using smart care system for prevention of COVID-19 in Taiwan. This is a good case for your reference. The elderly Peter has a chronic kidney disease and cannot speak. His original situation of fast breathing rate a day is about 40%, like blue color. One day, it is up to 70%. So our smart care system let the doctor check and diagnosis he had pulmonary edema. After the doctor and nurse do some medical and care adjustment, edema decrease and the rate decrease to his original stage. The doctor and nurse told me they are very happy because they can know their action is good enough for elderly quickly. Unfold became from a premature baby only 680 yuan and was developed about 10 years. It has been used over 8 years in baby hospital in Taiwan. Over 280 professional baby and elderly care centers are using now. It's trusted. So now I'm going to demo Unfold Smart Care System online. So just wait a moment. Okay. Please see, this is our smart care film, only 2 millimeters. You just put under the pillow and bed cover, then you can detect a lot of vital signs. So here, can you please see the screen and my hand? This is my little touch. This is my big touch. This is my continue touch. So we put it on the pillow. This is my touch. So you can see. So now you can know how sensitivity Unfold is. So we can now you can know this. We can know the patient status and sleep quality, and you can set in different alarms for different person about the no breathing, breathing too fast or slow. Then we create the smart care system together to take care of a lot of people at the same time. So you can look at the screen. This is our smart care system. For example, if there are 1,000 beds in the center or 10,000 patients at home,
Of course.
how to check their safety and health every day. Smart care system provides a 24 hours auto run. Every 4 minutes, we can know who is likely display automated or something wrong and give alarms. And the system provides a daily report. Compare with 1 hour or 1 day, you can know all the data, and you can check he is better or not with the.
Miss Yang, yeah, the time is up. Sorry.
Okay.
Yeah. So thank you for your sharing. Yeah. So the next we are going to. Sorry, I'm the moderator, so I need to control time. Okay, our second speaker is Mr. Benson. He is the Director of Strategic Business Development of LIPS Corporation. And his topic is coronavirus outbreak. Can 3D vision and AI play a part? Benson, please, your turn.
Okay. Hello, everyone. This is Benson from LIPS Corporation. And today I'm going to talk about how 3D vision plays a part in the COVID-19 fight against COVID-19. So, all right, can everybody see my screen?
Yes.
Okay. All right. So let me switch to my presentation. All right. Okay. So maybe it's the first time you ever heard about this our company name LIPS. So what does LIPS do? So we are a global leading provider of 3D vision and AI technology, and we have a 3D camera hardware and software, and also vertical solutions. So, so what is 3D vision? You might be curious, and but it's already actually in our life. So, for example, if you put the 3D vision in the automobile industry, then it's the hottest topic right now, the unmanned vehicle. And you put the 3D vision in a hotel industry, hospitality, that's unmanned hotel. So if you just apply the same formula to other industry, then you can see how 3D vision is going to play a big part of your life. So in coronavirus outbreak, to slow the spreading of coronavirus, right, many people around the world have turned to machine vision and imaging technology. So these may prove more effective. Some of the method may prove more effective than the others. So how does machine vision play a part? So for example, some of the machine vision technology is used for recognize or diagnose sick people, right? And while it can also spot the airborne virus particle and reduce that. In addition, many machine vision systems currently inspect, identify, and guide products like a ventilator, respirators, and protective gear. And so such products assist in treating patients and protecting a health professional, in turn further preventing the spreading of the virus. So for example, I guess now it's become a norm that we go everywhere and we start seeing this image, right, on the screen, the thermal imaging. Because many public facilities have installed the thermal camera to screen for people with elevated body temperature. And while you know, public facility has installed that, but then based on recent research, the best spot on the face to detect the core body temperature is the inner tear duct. However, when someone wears glasses, this creates a problem since the thermal camera cannot see through the glass. And so in many places, thermal camera just point at the large cloud. So it does not provide enough resolution. Also, machine vision can play a part in the vision-guided robots. So nobody at this point, I need a refresher on what is social distancing. So in hospitals, for example, it's very important to keep sick people away from the others. And so one way to do this involves vision-guided robotics, whether it's guiding or video conferencing with patients to understand how their symptoms are. These are all uses of the vision-guided robots. And there's also machine vision playing a part in the, for example, the diagnosis of the radiography images. So, for example, researchers from University of Waterloo developed this COVID-Net, basically a deep learning network that can detect the COVID-19. And also, drones are used. I'm sure you probably see a news or two, right, about using drones to actually announce the social distancing policy when they spot someone walking on the street if there's a lockdown. But also, in addition, Australian authority deployed drones capable of detecting infections, coughings, and all these vitals, so they can from at a distance. And also, drones are used for emergency response and medicine delivery and more. And these are like a part of the machine vision technology that can deploy for COVID-19 prevention. So, and here at the LIPS, we also develop our 3D AI sensor solution. And that basically can monitor, for example, elders' activity in the senior home at the distance. So it can also be used to monitor COVID patients and provide immediate notification to nursing aid for assistance if abnormal activity occur, such as fall or faintness. So we can take a look at a video that's showing how this solution is performing. sense the word. So basically, our AI sensor can install in a single room, maybe a 3x4, and can monitor the elder or patient's activity within a room. So for example, right now you see this patient is on the bed. So on the top left, right, it's a status that actually captured from the app. That shows the status of the patient. So right now, this Kenny is on the bed. And now he's get up on the bed. And then he's sitting by the bed. And now he's walking around. And then he's walking out. So the more important thing is LIPS can also detect like emergency situations such as a fall or faintness. So for example, if Kenny here, he's lacking energy and he's falling from the bed, and then there's an immediate notification of he falling down to a nursing aid or nursing stations. And then people will wonder, so what if there's more people present in the room? So right now, our scenario is that if there's more one person in the room, then the patient is being taken care of. And lastly, we do have an expanded module, for example, for late care, right, of the patient, where he might have extubation. So if so one of the major causes, right, of the danger is in extubation is the patient pulling the tube out. So we have a detection algorithm that can detect that kind of gesture. So in conclusion, in coronavirus outbreak, can machine vision and imaging play a part? Yes, of course. So machine vision and imaging technology have a role to play. So first, the traditional machine system support the production of the product and gear used in the hospitals for treatment. On the other hand, there's some technology help to avoid the potential spread of the virus by minimizing human contact and speeding up the diagnosis. So that's my presentation for today. If there's any question, feel free to ask, or you can write to me.
Thank you. Yeah, thank you, Benson. The last speaker is Antonio, and he's the International Sales Deputy Manager of ThinkCloud. So his talk is reduction of cross infections in hospital by using electronic consent forms. Antonio, your turn, please.
All right, everybody. Sabatika, kumusta, and everybody else. I don't know if you are like seeing my screen now.
Sure, clear.
So the idea, well, what I'm going to introduce is basically how we are going to do by reducing the cross-infection in hospital. Basically, we can see like every day in hospital, they are like having cases of COVID-19, specifically in isolation wards. We will see this picture. So probably we don't see something that is not normal. But basically what we do there is like, for example, what is the doctor doing there is basically processing the information of the patient. How is he feeling? What is the treatment that they are performing? But what they are doing is basically on paper. So once that you want to process that information, you have to bring that to the record rooms and give this to the record people. So they had to process the information and put it in the information system of the hospital. So this is a big risk of like contracting coronavirus or COVID-19. And specifically, we can see like there are some research that specified that like coronavirus on paper can be latent between 4 to 5 days. So if we bring this record to the record room, and then the people who has to process it, even though they have gloves, so then they touch their houses, like their faces. So the risk is higher to get. So in paper, the thing that we cannot do is specifically is like apply some like alcohol to basically make this clean. So this is why we use, like nowadays, while we are using smart devices. So one of the smart devices we can use, for example, it can be like smartphones, can be tablets, to process all the information. So this is what self-design is trying to help. Another picture that we see, for example, in countries like Taiwan, there are like some restrictions according to the visitors that you can go into the hospital to see their like families or to see their parents or kids, or specifically when you go to any office. So if you want to go to any office, you have to be registered. If you are an employee, basically you have to, if you are not an employee, you have to fill a form. So to basically track who's the person who's going to visit. So in this way, so like how self-design is coming to help to reduce the cross-infection and basically trace the patients. So this is like how self-design is applied in Taiwan, and many of the biggest medical centers, including Taiwan Christian Hospital, and most of the like what we call here East Chongqing, they are like university hospitals. So they are using our solution in the medical consent form. So, but specifically, one of them is like using it in the isolation wards. So one of them is like putting like, for example, instead of like the personnel or the medical staff going inside the wards, so, and they had to prepare using those clothes. Basically what they use is like putting a computer inside where they can have an interaction and they can fill those like patient checks or like daily checkups or their patient health. So, and then they process the information into the information system. And if it's like, for example, some patients that the families, they had to give the consent to apply some specific treatment. So basically they have to visit the doctor and they don't see the patient. So they can do it like the doctor can explain them and can like sign the consent to apply that, especially for patients that are in ICUs or intubated. So we can see that they are like in the picture there, we can see that the doctor is like showing what is the performing that they're going to do, and then they have to sign and present to the family. So we can see also some applications that we can like inside the hospital, for example, for registration, so they can go there and register and apply. They can see the registration form and they can fill the registration form. And then also the nurses, they can help and they can like decontaminate these like tablets. As well, we can send, for example, hospitalization forms. But sometimes there are some consents that they have to, like the families, they have to sign. So the patients, you can send this through email. So in that way, you can like contribute to the social distancing. So how is this done? And specifically, how to save time to adapt our solution into the hospital system. So basically, well, you already like every hospital, they already have all these package of consent forms, medical procedures. They have like certain different kind of forms. So basically, what you have to do is even scan it and become in a PDF file, and then create like an SOP of how this process is going to be signed, and what is like, for example, let's say this is a surgery anesthesia form. So where you can perform, like you can bring all the information of the patient from your system, and then the doctor can fill in like easily and like intuitive way all these fields, and then you can see, for example, who is the signer, like by verifying. So we can see nowadays, like for example, the digital is becoming a trend, and specifically in countries like Southeast Asia, even the governments that before like electronic signature was not allowed. So now the governments are opening to their systems. So especially in like healthcare, we can use self-design, for example, for hospital forms, new patients, onboarding forms, billing forms, patient forms. And there are some care documents, medical prescriptions, drug prescription. And then in that way, for example, one of the most affected part of every country is basically economy. So because, for example, the self-quarantines or the self-isolation, so you have to conduct daily checks. So you can send those forms, even you are in your own house, you can send that form, or your employee, if they are working from home, you can send that form, and they can fill those health checks. And then people in your company can have like basically can monitor if you are like feeling okay, if what is happening with you. So like, for example, in that way you can have also like some tracing, because self-design, despite the what is the form, basically what we provide as well is like a GPS of the person who's signing, where is he signing from, and also like the IP tracing. So in that way, for example, governments can verify if that person is like if in the 14 days regulation quarantine, so they can verify if they are like signing and that person is signing from their location. So in that way, we can enhance digital economy, and we don't need to be in that location. I believe, like, for example, if there was no COVID-19, pretty much this webinar will be like a seminar, not webinar. So in this way, we can have like more interactive way and don't let the economy like feel affected. So you can feel also for hospital, they can have like a big savings on terms of copying and processing the information. So as well, it's legally compliant, so it's according to every country's regulation. So, and enhance the security of these files. So by not having paper, so you can have also like social distancing, and you cannot, like, for example, pass this record from this department to the other department. So in that way, you reduce cross infection and you improve the fast availability of that data. So in that way, patients, they will feel like a better treat, and then you can focus on them. So we can see here, like, for example, there are not just partners in the hospital area. So we have partners in the private sector, like insurance companies. We have like other companies that are like using, for example, for the admission form inside it's a way of like controlling people who get into your office. And like by using self-design, we basically got awards nationally here in Taiwan. There is like the government award, like of the Ministry of Health and Welfare, by making one of our customers the first paperless hospital in Taiwan. And then we have like patents in Taiwan, US, China, Indonesia, Singapore, and Japan. So pretty much this is all my presentation. So you can, like, if there is any information that you need to ask more, so pretty much here is like you can scan the QR code and you can text me. So in terms of like the type of application of this system into your own hospital information system, probably might take like 2-3 months to develop and to be deployed inside. So pretty much it's like and it's saving money for hospital as well.
Okay, thank you, Jose. So thanks all of our 3 speakers' presentation. Before we start our QA, we have 2 or 3 reactors with feedback on today's session. So for first one, could I ask Dr. Apichai from Walalaka University School of Medicine? As I know, Professor Pong and your team are the key person to take responsibility on Walalaka Hospital, his system, the hospital information system design and construction. So do you have any suggestion to the vendors who want to promote their medical device to Walalaka University Hospital? And anything you think they need to well prepared in advance if their product have to be integrated to the hospital information system? Dr. Pichai, please.
Thank you for your question and the opportunity for me to share. I think we would like to concern about the 3 components. The first one is patient. Patients need something that are beneficial for them in terms of quality and safety. The second component is providers, I mean healthcare providers, because we need something that we can use, I mean usability and also utilization. And the last one is cost effectiveness. Of course, it is very important that is not too expensive, but we can use effectively. And we also need something about to enhance the quality of education and research, because in a university hospital, we have to teach medical students, nursing students, and so on. And also we have to apply the medical technology for research. And for the vendors, you have to, I think the understanding of the bidding system or regulation, for example, international companies who want to come into our country, sometimes you have to understand the system. We have the national regulation because we are a public sector. So we cannot buy anything what we want, but we have to follow the regulation. Lastly, I would like to mention the system, the service system, because when you sell products and we use the products, we have the maintenance. So if we can contact the companies regularly and conveniently, it is very important to think about. Thank you. It is my opinion.
Thank you. Very good point. Yeah, let me summarize. First one, the patient safety and quality, very important. I think that's for most of the hospital. Second one is health providers usability. That means friendly to use all of that, the equipment or devices. The third one is a cost. Of course, that I think most of the hospital cannot buy the too expensive of equipment. Yes, and the other one is an education research, because while like university, you are the public university, and the research is also very important in the education part. So you wish that the equipment can be combined or integrated to the education research, and the system is also very important. Yeah, particularly I think at Thailand, your insurance, you have 3 different systems, and you are the public university hospital. So do you think it's very difficult when you set up like the hospital information system, you have to incorporate the 3 systems in one time, or any of that when you set up the system? Can you tell us more about this, Dr. Pichai?
Okay. Yes, sure. We have improved all the insurances, because we have the we have the system we call universal health coverage. That means all Thai people are under any insurance. So we have to care all patients who come into our hospital.
So the universal health coverage, that's your main part of the hospital in the future, right?
Yes.
Okay, thank you. The second our reactor, I would like to invite Bangkok Christian Hospital Director, Dr. Chosek. I'm not sure. I think that he's online, because I know Bangkok Christian Hospital is going to construct a new building, and you wish that its design could be toward a smart and green hospital. So do you have any suggestion to the presenter in the future, if Bangkok Christian Hospital want to purchase their product, except like the good quality, easy operation, reasonable price, any other you wish the vendor can well prepare in advance? Dr. Chosek, well, yes, please, Bangkok Christian Hospital.
Hello, can you hear?
Sure, please.
Okay. Thank you for all the presenters this afternoon. All your 3 products are very impressive, and I'm sure it can be made use to benefit many patients. The thing that we would like to see is you know, from our short exposure just now, we would really like to learn more about your products. So if you actually have some conference or exhibition in Thailand, we would like to attend, or even better, if you can visit hospitals in Thailand to show the products to users. I think it will benefit us in deciding which is suitable for our hospitals or not. And I think the major concern for us for these products will be who will be the distributors in Thailand and the after sales and looking after of these products that we can contact easily. So I mean, seeing from all your products, I think it is very good, but if you can connect to some distributors in Thailand to be able to demonstrate the products in various hospitals and to be sure that there's after sales and looking after it, I think it'll be could easily be widespreadly used in Thailand.
Okay, thank you. I know like the Huijia, you already have like distributor in Thailand, is right? Jose, you also have the distributor, right, in Thailand?
Now we are discussing about the because COVID-19. So I think we will maybe the end of the year. I think we can
find a distributor.
Yeah.
Okay, good. How about Jose? You heard product?
Yeah. Well, in this case, like basically our product is like well, you can go to our website and you can like integrate our API into the information system. So it's like it's not gonna be like a big deal in terms of that. In terms of deployment, we have a company that we can cooperate in Thailand, because in terms of like what like they were saying, it's very important to know about the culture, how people interact within the hospitals. So it's like it's not the same, for example, in Taiwan, that there is a universal insurance system, so people are like more localized in terms of hospitals. So that's why we cooperate with that like information technology company in Thailand.
Okay, Jose, continue, because someone asked that in your product, do you have like the policy confidential, the cyber or like a privacy confidential issues? You think about that?
Yeah, in terms of hospital, there is like some certifications that you need to have, like a certification in ISO 27001. So basically, we have these in terms of this certification in terms of hospital management of the records. So, and there is like well, in terms of this is like a worldwide certification. So pretty much like then if there are some other, we are not like, for example, like FDA, we don't need FDA approvals or stuff like this. But in terms of like cybersecurity, we do have some certifications like ISO.
I see. Thank you. Benson, how about your product? Do you have the distributor in Thailand yet?
Not at the moment. We are just launching our product this year, but also, because of COVID. So there are a few exhibitions that we planned originally in the first half of the year that couldn't make it. So we are definitely looking for partners to work with us in Thailand.
Okay, and can I know the price? Because someone asked if they would like to build like a smart healthcare system, and how about your price?
Right now, I know the MSRP might sound a little high, but right now we do have our product that's introducing a Japanese market. So in Japan, the MSRP is about maybe $3,000 US. But then that if you counted the nursing care, the resource that you save, it's actually not that much. But we also trying to work with our partner to build a leasing model as well, so that can lower the cost. of the ownership.
So your products is already applied in Taiwan, yeah?
Yes, we do have several nursing care homes that partner with us, and but then again we are working with maybe 2 partners here in Taiwan to deploy the commercial trial. So right now it's more POC based, and we are also trying to ramp up the deployment.
Okay, very good. So I want to ask Huijia, because I know your products also using like the leasing your products to the how to say this one, they don't need to buy, they just like leasing your product and they pay the rent every month. Do you face any difficulty for this system?
Actually, we need to rent this product. In Taiwan, I think only provide monthly fee. They give us the monthly fee, so don't need too much. Every month is about $33 USD. Every day is $1. I mean the end customer. So you can 24 hours auto run the patient safety and health and give you alarm. So now we save, example, one center, they use only 10 beds. They save 2 elderly life a short time. Yeah, so we had a lot of successful case can provide how to use our smart care system.
Good. Yeah. So the price quite reasonable. Yes. Okay. I want to open for the QA for our participants. If you want to ask the question, you can identify your name and your organization and address to which one of the speakers. Anyone would like to ask the question? Because I know we have friends from like Indonesia or the Myanmar. Yeah. Anyone would like to ask a question? Or any comments? Yeah. For our speakers. Yeah. I think that for us, the hospital just like a bridge to bridge the Taiwan outstanding companies to the Asian countries. For the main purpose that we would like to bridge them and bring them to lots of countries and promote their very good product. And I also wish that like Thailand or other Asian countries, you can purchase a very good quality of product with a very reasonable price. Particularly in Thailand, I know most of the hospitals, they buy like the machine or equipment, most from Europe or from United States, and the price is quite high. And the maintenance sometimes is also a problem. However, I think that Taiwan, we have very good quality products, but the price is quite reasonable. The problem is we need to find like the Bangkok Christian Hospital, Bangkok Christian Hospital mentioned, we need to find like the local distributors to help all of our the companies to deliver or to distribute their products. And also, I think they need to have good maintenance, in the future. Yeah, actually, last week we have like another company in Unison. They would like to build a platform for the to also like to bridge of the Taiwan companies, and they would like to play like the local or the Thai of distributors to help the companies to deliver their products. Yeah. If no question, yeah, I think time is already up. So thank you very much for everyone joining us today's online seminar. The next session is our last series of session will be on July 3rd. On July 3rd is a very special session. We call a nursing special session because I found many of the online seminar we're talking about the COVID-19 prevention. We're more focusing on the doctors or how we prevention, but almost no one to mention the nurse. I think the nurse is very important during the whole of our prevention or many of our care of patients. So next week, we are going to invite Thai nursing division of Ministry of Public Health, and the other one speaker is from Java Christian Hospital. We are going to dialogue with how the nurse, their role and their what their tasks when they care of the COVID-19 positive patients. So welcome to join us next week. So bye-bye. Thank you so much. Join us. Bye.